false information can be especially damaging. I have seen this in my own practice. Unfortunately, many of us are very aware that female partner age is the biggest predictor of success. So I think the way that it can be most damaging is causing a delay in one's treatment. So I think if you think you've read something and you're doing everything right, but it's just not yet clicking, you're not getting to where you want to be with pregnancy or with fertility preservation, if that time is passing without you seeking the help that you may need, that's where it can be most damaging. We don't know when, but every woman will reach a time in her life where she can no longer get pregnant with her own eggs. And we don't know when that window will close or how fast it's approaching. So I think, again, just delaying treatment, delaying workup because you think you've read something that may be helpful in your case, maybe that doesn't consider, your whole history. So I think it's important to get worked up and treated in a timely manner. I think there is a lot of information out there right now on the internet about infertility, fertility treatments, particularly IVF and ART. I think it is prudent to follow providers, of all levels. That can include physicians, embryologists, advanced practice providers like nurse practitioners and physician assistants. I think one way to know that it is a legit source is to consider where that person is coming from. And just so you feel reassured, most of us physicians rather, we have gone through many years of training to be able to practice reproductive medicine. Those sources will likely have either board certified or board eligible notations listed. And that is sort of a marker that that person has gone through the appropriate years of training. They've gone through the many stages of board exams to be able to practice reproductive medicine. So I think anyone with those credentials, and like I said, there are many other care providers that are so critical to the function of fertility clinics, nurses, nurse practitioners, physician assistants, embryologists who also have things and pages, if you will, on the internet and on social media. So those are some good ways to find out. I would say a rule of thumb would be, one of my favorite colleagues used to say, don't worry alone. So if you're worried about something, don't let it all be in your head and take action. And also rely on the resources that you have through Progyny, through your healthcare provider. So don't worry alone. Come and see us on the sooner side rather than the later side. Don't hesitate to reach out to a provider in your area.